Cancer is a term used to describe 100 different diseases that have a certain feature in common. Cancer is generally named for a type of organ or cell that which the cancer has begun to grow. When we hear about cancer, another term such as tumor frequently appears. So what is a tumor? A tumor is any mass or swelling of the body. There are two different types of tumors: benign, which is non-cancerous, and malignant, which is cancerous. Since the cells cannot be seen with the naked eye, doctors and scientists must examine it under a microscope to examine it properly. Taking a closer look, we can understand the basic terms of cancer. But today we're going to focus on a specific cancer, esophageal cancer. Now, this can get confusing, and you're probably asking, what is esophageal cancer? Well, I interviewed a professional, and this is what he said.
Our cancer is called squamous cell carcinomas, and then there are adenocarcinomas. And the differences are essentially in the type of cell that the cancer comes from and the type of patients that get those cancers. And these types of cancers come from the surface of the esophagus. You know, the esophagus is obviously the tube that connects our mouth to our stomach. And patients that got squamous cell carcinoma, for the most part, are people that drank heavily and or smoked heavily. What is becoming more common is adenocarcinoma of the esophagus, which comes from the deeper glands of the esophagus. And usually this is diagnosed in people that have a long history of reflux disease, which is commonly known as heartburn, but we call it gastroesophageal reflux disease, or GERD. There is a muscle between the esophagus and the stomach that keeps the very acid environment. It is very acidic in the stomach, but it keeps it there and not in the esophagus. But if that kind of gets back up every once in a while and you experience heartburn, you know, it's not only problematic because it can cause symptoms, but over time that acid can actually promote the cells to behave differently. And it irritates them enough to where they can cause mutations in the cells. And mutations are really the key to cancer. When the chromosomes are dividing, they should create an exact replica of themselves. But if they make a mistake because of some outside influence, you know, we think about things like pesticides and radiation and this as cancer causers, but in this situation it's acid. And when it causes a mistake in that copy process, that's when cancer happens. What we have learned is that cancer cells also have abnormal proteins and molecules on them that are not present on regular cells. And as we become more able to design medications that can target that, or can target certain aspects of the cancer cell, then we're able to do targeted treatments and not and treat the cancer, but not treat the other cells that we don't mean to harm. Would be IV medicines that include things like platinum, which is the metal, which interferes with cells dividing. There are also a couple of drugs that come from the yew tree, which are kind of natural poisons from the yew tree, actually. Taxol and Taxotere. And probably the oldest medicine is a medicine called 5-fluorouracil, and there are different versions of this, but it basically doesn't allow the cells to divide. And so these are kind of the standard, but those are the ones that we probably use the most often and in the beginning for treatment of esophageal cancer, as well as a medicine called irinotecan, which is relatively newer, which does the same thing in a different way, but basically keeps the cells from dividing. But the problem is that because all these cells, all these medicines keep the cells from dividing, other cells in your body do grow quickly. So that's things like your hair follicle cells, which can lead to hair loss. The blood cells in your body grow quickly and replenish themselves every few days, and so they will be lowered and causing fatigue for the patient. And then because these medicines are essentially poisons, the brain recognizes that, and the natural tendency when the brain recognizes a poison is that it thinks that you ingested it, and so it causes nausea and vomiting and trying to get rid of the poison. And so nausea and vomiting is really a big side effect from all of these types of chemotherapies. Fortunately, we have a lot better medicines today than we did, say, 15 or 20 years ago to prevent these types of side effects, but there's no doubt that the side effects are still severe. We've just gotten to a situation where 15 or 20 years ago we had to give most of these medications as an inpatient in the hospital because the side effects were so severe, and now people can at least stay home during their treatments, but the side effects are still there. Cancers are staged 1 through 4, with 1 usually meaning that the cancer is only in the organ it started. Stage 2 and 3, depending upon the cancer, indicates that it perhaps has gone to the surrounding areas, maybe to lymph nodes, for instance. And those types of stages of cancer are often, sometimes it's treated with radiation and chemotherapy together if it's a little bit more widespread. But then stage 4 in almost all cancers indicates that the cancer has gone into the system, into the bloodstream or lymph system, and has gone to other types of organs. And because of that, with stage 4 cancer, we have to depend upon chemotherapy because of the fact that chemotherapy goes through the blood system and can treat the cancer in all those different areas. For instance, if we had esophageal cancer that's stage 4, taking out the primary tumor with a surgery would expose the patient to a lot of surgical risks, but at the same time would really do nothing else for the rest of the cancer in the body. And so we don't usually do surgery in that type of situation, but depend upon chemotherapy to be able to treat all those areas at one time.
Esophageal cancer has major risks. These include smoking, excessive drinking, and gastroesophageal reflux disease. Warning signs of esophageal cancer is difficult or painful swallowing, chronic indigestion, persistent heartburn, coughing, hoarseness. Having esophageal cancer can change aspects of your metabolism in your body, resulting in weight loss, fever, sweats, and fatigue. Since we talked about the medical and the physical aspects of esophageal cancer, we are going to take our second part of the documentary, the emotional battle of esophageal cancer.
Well, the support system is my wife. Feeling that she's close to me and we can talk about it.
Brandon is a big support system. Just to see him, what he's going through right now, and just him fighting it is a big support for me.
I have support from his family and my family, and definitely from our church family and all the friends that we have.
And so my support system is God and the body of Christ that surrounds our family every day.
Brandon's a good support system to me too.
Since I'm with him most of the time, I try to be there and help him when he's having a rough day and just try to make him as comfortable as possible. I just try to be there and support him all the time.
There's some things he can't do because of his chemo. So what we want to be there is for him to do the things that need to be done, that he'll never be alone. He'll always have somebody there to help him.
Try to support him in ways that, hey, if he wants to hang out, if he wants to just stay silent, if he just wants to talk, that I'm there for him.
I show support by being there for him. Spend time with him, try to make time with him.
Coping with cancer is difficult only when it's closer to treatment, that's when you feel the sickest, when you're dealing with most of the side effects of chemotherapy. Physically, I've been struggling after each treatment to stay healthy, not feeling sick to my stomach or nausea. Emotionally, I've had to deal with a lot, and I've gotten through it thanks to the Lord's help and being able to rely on Him for strength. I think as I go through it, I get stronger. Well, most important, my family's always there for me. They come to all my treatments, and they are there for me when I'm feeling sick, and even when I'm not feeling sick, they're always there taking care of me when I need it. For my friends, they're always looking to do whatever they can to help. We don't have much that we can offer them for help, but they always are willing to. And then our church family is always praying for us, and that's really encouraging.
Immediately with our just family situation, we're just, having to put on hold, we wanted to build a house, or we wanted to, move into a nice place, or have kids or something, or just kind of have to put everything on hold right now in order to make sure that he's taken care of, and that I can make sure that I'm doing whatever I can to help him. And so that's kind of how our dreams and our future aspirations have changed.
Certainly I wish to be cured. I don't know if there's anything else I'd rather wish for than that at this stage, so.
Let us reflect, even for today, the simple things in life, and put the battle behind us.